This is my presentation about fentanyl. I am Jake Fisher. So, the history of fentanyl was created back in 1959 by Dr. Paul Janssen. The drug was created to be a type of anesthesia and was found to be somewhere around the times of 50 to 100 times more potent and more effective than morphine. Um, But as the drug had progressed throughout its life, it had developed into multiple ways of uses, such as nasal sprays, tablets, skin patches, and this was kind of brought to around the ages of the 1990s. So to continue some of this, from 1999 to 2011, the death rates had increased by 4 times. Um, and along with that, they started lacing it with other drugs as well. And to go even further down the line of their time period, around the between the times of 2015 and 2017, there were a total combined deaths of 95,000 just in those 2 years alone. So some of the social correlates of fentanyl was it was the misuse of fentanyl came from the healthcare system. A lot of people were going in for minor pains and they were getting prescribed fentanyl. Along with that, it kind of helped increase the addiction to it as well. It affected a lot of communities, along with low-income minorities. Along with how it affected people, many people were able to get their hands on this drug. Along with this, it was able to be sold on a mass scale, and this increased the drug's popularity in communities and affected many lower class people. To continue some of that, people who take fentanyl have been known to take more risk and more impulsive. Many of the current users, and this is from a healthcare or health psychological research center, most of the current users are said to be younger, white, with a mental illness, and typically involved with something illegal. Along with that, the Health Psychology Research Group says that 21% of people just prefer fentanyl. 21% of people prefer fentanyl just by itself, no other drug or alcohol or nicotine or anything like that included. And 31% of people prefer heroin laced with fentanyl. Finding those numbers, I thought that would be ridiculous, and this study was out of 200 feet or 250 people. So the historical and current trends of fentanyl, the drug has completely changed since it first came out. When the drug was introduced back in 1959 from a controlled substance used by specialists in hospitals to a huge part of the drug, or then became a huge part of the drug market. It started with the overuse of the way to obtain fentanyl, the skin patch or the nasal spray, along with doctors prescribing it in a lot of situations. From there, it evolved into junkies getting a high from it. This method continued for many years up until the 2000s. It was kept relatively maintainable. After the year of 2000s is when when there was word about outside operations that were set on manufacturing the drug. This is where the new trends of the drug were made. People started lacing other drugs like cocaine, weed, heroin, and various other sorts of drugs. It became a completely new drug that was way more potent and way more deadly. The media portrayed it very negatively and wanted to show people the truth behind it. The media often shows fentanyl as a deadly drug and is often a very dramatic way of displaying that as well. Along with that, you can commonly hear with the mentioning of fentanyl that it is one of the leading causes in the opioid epidemic. Furthermore, news stations frequently use people's stories with the drug, and for the public eye, they hopefully try to scare anyone off tempted to try the drug or trying to get anyone to help someone else quit it as well. Some of the treatment and prevention ways of trying to get fentanyl off the street was the way the government is trying to handle this epidemic is with the use of assisted treatment plans along with enhancing public education. They want to have people know more about the drug and have the ability to at least know what they're getting into. They are expanding treatment centers for victims of the drug as well, trying to help people go through that recovery process. Currently, the government is also processing, or the government is in the process of reallocating limits on federal grants. This would allow people the ability to purchase the test strips and other various necessities to try to help them through either their overdose withdrawals or anything to help them stay safe and get off the drug. Alongside their treatment for people, they are trying to prevent the manufacturing of the synthetic opioids with trying to seize shipments coming over from overseas or trucks coming over from Mexico. The U.S. delegate met with China to try and reduce the production of fentanyl drug currently being shipped to Mexico. Legislation, legalization, and harm reduction efforts. Legislation has been focused on trying to prevent the misuse of the drug along with curbing its production. The way that they plan to do this is to try and support or get the help with China, because right now China is the leading contender in the production of the synthetic opioid, and they hope that they can try to find a way to keep it more over there and out of the United States. The drug is currently being represented as a level 2 controlled substance. This subjects them to harsh penalties if they were to be distributed illegally. It also has very harsh punishments of the creation of the drug if they find someone who is actively doing that in the States. The way they hope to reduce the harm of the drug is by setting up supervised injection sites. This allows people who are addicted a safer way of getting the fix, along with needle exchange programs. What this is it allows users of the drug to go in and switch out from a used needle to an unused needle, trying to keep them a little bit more sanitary and safer from any other diseases they might be at risk of. That was the end of my presentation.